In this video, I'm going to go through the recovery from male chest surgery post-weight loss, referred to as the upper body lift or the torsoplasty. So the torsoplasty it comes in two. So the recovery from it is fairly similar, but obviously with the one that's circumferential, it's going to be a little bit longer recovery and a little bit more wound and more likely to have wound breakdowns and problems. The anterior torsoplasty is the front of your chest, and then the circumferential is where we go in the front as well as around the back and the side of your chest. The circumferential is twice as big as the anterior, so it usually tends to be a little bit more of an intense recovery period from that. With the recovery, hospital first. Once you wake up from your operation, you'll be in the recovery ward. Then you'll move to the surgical ward. Usually, you'll be in hospital about 2 days, 1 or 2 days. You'll have drains coming out of the chest. I usually remove those a couple of days after when the fluid from the drains are less than 20 cc's. In 24 hours. You'll have a compression garment on that puts pressure on the chest. With the torsoplasty, you'll have also nipple grafts. So you'll have a little dressing that's pushing on the grafts, and we remove the clips from that at day 10 after the operation. You'll have a suction dressings or PICO dressings under the wounds, and the incisions will be just under the pectoralis muscle going up to your axilla and around the back if you're having a circumferential. So those are all things that you can expect after. The first day is usually the toughest day with recovery. You'll have possibly a catheter, IDC, depending on how long the operation was. You'll have PCA or patient-controlled analgesia. You'll have the drains. It'll be difficult to mobilize. Sometimes there's low blood pressure issues and things that happen after an operation. So the first day will be really tough. The key thing for you to do is to get up out of bed, mobilizing, doing your lung exercises. So we have a little incentive spirometry thing that helps expand your lungs to try to avoid any issues with atelectasis or lung collapse that happen after surgery. We get you out of bed to try to avoid the DVTs or clots in the leg. Mobilizing will also make you feel a lot better. So that's the first day. Second day usually is a lot better than the first day, but you're still going to have quite a lot of discomfort. It's going to take you time for that to settle down. There'll be some bruising in the area. You'll have pain on moving and that sort of thing. Once you get out of hospital, the first 2 weeks are the intense period of recovery, and that's when you see me and my nurse in the rooms, and we do dressing changes, look after the wounds. And there's be a couple of dressing changes. There'll be the dressing changes from the PICO dressings. So those are the suction dressings. Those are day 7. Then there'll be the taking the clips off for the nipple areola grafts, and that happens at day 10. Once you get through the 2-week period, usually you can start driving. Usually there's a lot less wound care required. And usually, obviously, there's still going to be pain at that stage. The pain probably completely settles more towards the 4 to 6 week mark. There'll still be tightness and things after that period. So it's quite a long recovery from, it's a complex operation, so it's a long recovery. Once you're over the first 2 weeks, you'll feel a lot more comfortable, be doing most of the day-to-day stuff, be able to go back to a desk-type job and all that. So that's at 2 weeks mark. Usually if you're doing heavy lifting in your job, then you have to do it 4 to 6 weeks. And then my standard follow-up is 1 month, 3, 6, and 12 months. If you get a wound complication, wound breakdown, some sort of other issue, we just keep seeing you to make sure that that's all fine. Going back to work, if you have a desktop job or working from home, probably about 2 weeks. If you don't have a lot of pain, you can probably go back to doing work at home at 1 week. Driving 2 weeks, more sort of lifting and things at 4 weeks onwards, and then being back to doing everything you're doing now, about 3 months. So gym and exercises and things like that, start very gently at 2 weeks, and then 4 weeks onwards, usually you back to doing most things. I usually recommend doing the lower legs first, so squats, bicycle, that sort of things is first, because you want to be a little bit careful with your upper chest area, and then you go on from there on. So recovery period is quite intense for this operation, but once you get to 4 weeks, it's certainly a lot easier. Most of the problems we get are the wound-related stuff, and that's dressings and wait for things to settle. I hope you found this useful, and I'll see you in the next video.